Hello again. Thanks for staying with us here on Joy News Prime. Now, out of every 5 children in Ghana has a functional learning difficulty. This learning difficulty is more common in children aged 5 to 17. This according to findings by the Institute for Educational Planning and Administration at the University of Cape Coast. The research notes that the situation is a major contributor to falling educational standards and warrants the immediate implementation of the country's inclusive education policy. Meanwhile, many teachers lack the ability and knowledge to identify such students in order to provide assistance to them. Samuel Imbura has more in this report.
The findings, which seek to identify challenges confronting inclusive education in Ghana, indicate that pupils with disabilities have consistently poorer learning outcomes in reading, writing and maths than pupils without disabilities. Director General of the Institute for Educational Planning and Administration, Dr. Michael Boakye-Yiadom, tells Joy News the challenge needs urgent attention.
Generally, we realize that there seem to be many more children with disabilities, otherwise referred to as differently able students or learners than we thought. That is the first point. The second one is that there also appears to be a lot of misunderstanding, inadequate knowledge about the characteristics of these differently abled learners. We might have assumed that many teachers have a very good idea, good knowledge of who they are, how they operate, and how to support them. But what we are realizing is that knowledge on the kids and who they are, their characteristics, is limited.
The highest proportions of children with functional difficulties were found in Volta, Eastern and Upper West regions. Laura Lechi Atachi teaches at Kumbuni RC Basic School in Sogakope of the North Tong district in the Volta region. She tells Joy News that identifying learning disabilities among her pupils has been a major challenge in the classroom.
Sometimes it's very difficult, but as teachers we are trying our very best to identify at least the minor ones that we can identify and manage them appropriately. Sometimes the sitting position in classes also, it's one of the methods we use to help such people, especially those who have problems with maybe their eyes or their ears.
Peterson Kwesi also teaches at Aduto EP Basic School in the South Tong district. He wants the government to train and provide resources for inclusive education.
We are hoping that gradually these trainings will be done to equip us with necessary skills, knowledge, and some level of values that we can use in handling learners with disability.
We can now speak to the Director General of the IEPA of the University of Cape Coast, Dr. Michael Boakye-Yiadom. Thank you very much, sir, for joining us. First of all, Doc, tell us about the scope of the research and the methodology you adapted.
Very much, Ernest, and good evening to your viewers. So this is the Innovative Pedagogy Project, and it's a partnership between the Education Commission and the Institute for Educational Planning and Administration at the University of Cape Coast. The whole idea is framed within the Sustainable Development Goal 4, where we talk of ensuring inclusive and equitable education for all. There are a lot of issues related to inclusivity, and this project is limiting itself to how to innovatively support children, and especially children learners who are differently abled. What we realize is that, so from the literature, available literature, from observation, and then from the specific methodology that we use, we first did the Policy Dialogue 1, which was 2 months ago. And during the Policy Dialogue 1, we interacted with stakeholders. We wanted to find out from them what they have observed in the school system, especially the primary school level, regarding the support and the way we teach in supporting children generally, and in particular children who are differently abled. Sometimes we refer to them as disabled children. Now, after the first policy dialogue, we realized that many stakeholders, including teachers and some parents, have limited knowledge on how to support kids who are differently able. Now, we followed this up with a rapid research where we went to the field and interacted with school leaders, with teachers, and with some stakeholders within the education sector in their own space, and also had data that confirmed some of the issues that came up at the first policy dialogue. And that was the fact that many stakeholders, including some school heads, including some teachers, seem to have limited knowledge about the various disabilities that children learners in their classroom demonstrate and how to support them.
Okay.
Then
So,
after the rapid research, we came back for the policy dialogue 2, which happened today in Accra. And again, confirming the fact that in terms of knowledge about the various disabilities, in terms of location where they are, in terms of the kind of support that we give them, these data are limited. And therefore, the big question came up as to how we are supporting these kids. And
exactly, that is why I'm coming to Doc, because I see from the document you shared with the media today, I see that the challenges ranges from logistical challenges to issues about perception and culture, and also a general lack of awareness about these disabilities. What do you recommend should be done to help the children?
So we are recommending innovative pedagogies. We are recommending sensitization among stakeholders. We are recommending government to demonstrate more commitment in terms of providing resources. Taking good care of children with learning disabilities is expensive, and therefore our expectation is that various stakeholders, including government and development partners and all that, would support in terms of logistics, in terms of resources, to provide what these kids need in the school system. When it comes to even assessing which child has what disability, tools and resources to do this are limited within the school system. So these are some of the recommendations that we are making and we are putting out there. And we believe that through our policy dialogue, we'll be able to bring these issues to the table for us to look at them, for us to discuss them, and to find ways of supporting all children, irrespective of their abilities or inabilities.
Very well. Doc, I'm grateful for your time. That's Dr. Michael Boakye-Yiadom, the Director General of the Institute of Education Planning and Administration at the UCC. And so he mentioned government. We've been looking at what government has done as far as this area of special education is concerned. My colleague Kofi J is with the research desk and joins me via Zoom with findings on interventions by the Ministry of Education and dealing with inclusive education. Kofi, so what does the data say about what government has done in this area?
Right, and so we picked this data from the Education Ministry's program-based budget, and according to them, Ghana currently has an inclusive, special education program, which seeks to ensure that provision of education for children with special physical and mental needs by integrating them into the formal system or the special schools. Now, according to the same data which was released by the Education Ministry, there are 31 special public schools, out of which 4 are second cycle schools. And in 2021, it also says that a total of 1,281 teachers were trained on how to manage and support learners with specific learning difficulties.
Okay, and so does it say in terms of the resources, for instance, to be provided to these, institutions, and of course the training for the teachers as well?
Well, so everything is under the umbrella of the inclusive and special education program. And looking at the data, you could see that 2008 being the indicative year, you could actually see an improvement in the enrollment at the basic school level, which has increased from somewhere 5,000 to 7,800. So it means that This program that was outlined by the ministry is actually yielding results according to their data that they put up.
Okay, Kofi, thank you very much. But let's find out how some private schools are able to run inclusive learning to help meet the needs of learners. Priscilla Afote is a speech therapist and she works in such a school here in Accra. She joins us on the phone. Priscilla, thank you very much for joining us on Joy News Prime. Well, she actually joins us on Zoom. You work in a private school that runs inclusive education policy. How are you able to run this model, as you do at the school you work?
So we use the transdisciplinary team, which is made up of the applied behavior analyst, the speech therapist, the occupational therapist, and then the physiotherapist. What we do is, as we are taking care of their educational need, we would like to take care of their health need as well. And this team involves their parents and then some medical authorities. We put in place the individual educational plans where we set short-term targets, and these targets are supposed to build up for them to climb the educational ladder. So the individual educational plan are tailored to suit each child. That is, if I have an educational plan, it wouldn't fit in yours because you are a different child with different needs. We may have the same condition, but then your educational needs will still be different from mine.
Okay, so I see that you try to address the specific needs of the children, but help us understand, do you put all of them together in a classroom? Because I guess the whole idea of inclusive education is to make sure that people are not segregated, but then you go out of your way to meet their needs so they could catch up with those who have less challenges.
Yes, we do put all of them in one classroom. Our classroom size is very small, so you can have about 8 to 10 people in a